I would like to assure you of the commitment of the Kenya government to ensuring access to comprehensive prevention, care, and treatment services to all. The government has worked with different development partners and stakeholders to reduce the burden of treatment by providing antiretroviral drugs to eligible persons living with HIV. Though the cost of HIV treatment has substantially reduced, many people still lack access to the life-saving drugs. The government is doing its best to ensure that access to antiretroviral treatment is enhanced. This is part of our commitment to the global target in meeting and reducing the number of HIV cases. In this regard, we have put in place mechanisms to ensure that we acquire and roll out the latest care and treatment technologies, including injectable ART, beginning next year. As we speak, we have a total of 1,326,336 people living with HIV amongst us, basically 1.4 million people. Every year, Kenya requires 30 billion Kenya shillings to procure commodities for the prevention and management of HIV. As at 2024, 87% of people living with HIV were on the life-prolonging antiretroviral treatment, ART, with a PMTC coverage of 90.1%. This has had a direct effect as people are now living longer with the virus, while HIV-positive mothers are able to deliver HIV-free babies, courtesy of technological innovations. This is a big challenge. We cannot afford to let it go because the resurgence is worrying, the resurgence is aggressive, and the resurgence needs to be checked before it finishes our young generation. The data that we have had from 16,000, I think 3 years or so ago, to 19,000 young, almost 20,000 cases. It was 19,900 and something new cases of the young perishing because of the resurgence of AIDS is something for us to worry about and to reflect. Fellow Kenyans, unless we mitigate its effects, HIV and AIDS will continue to have a wide socioeconomic impact that threatens development, progress in Kenya. This is particularly so because it affects the most productive and energetic, people aged between 15 and 49 years. Employees, both in the public and private sector, are affected. In view of this, the Kenya government, through the National Syndemic Diseases Control Council, has developed strategies and facilitated the right environment that allows multi-sectoral interventions and promotes public-private partnerships in addressing HIV and other syndemic diseases. I'm talking to the young people in particular that let's not go too far. Let's just look within our midst. And you'll find that this disease knows no boundaries, knows no status. It clears everybody. In fact, as much as we may speak in our speeches as hitting the poorer communities or the less endowed communities more devastatingly, don't be cheated. Even the well-to-do, even the wealthy are not spared. So it is not a disease that affects the poor. It's a disease that affects humanity. Everybody alike. So let us be together in our strong campaign against the resurgence of HIV/AIDS. If we don't let people see some of these things, just the way we saw the video in Busia, then they may not believe you. They may think it's a joke. It's painful. It's never intentional. That is, the contracting of the disease is never intentional. You just find you've been caught up. So it is real. We need to talk to our young people. We need to be courageous, the way you said. If we don't inculcate it now, integrate it in our educational processes, we are only living in denial. We should not live in denial on this matter. It is real. Today, it is estimated that more than 33 million people in the world are living with HIV. Of these, more than 22 million live in Africa, with approximately 3,200 people dying every day from AIDS-related illnesses. Furthermore, AIDS is the leading cause of death among adolescents in Africa and the second highest cause of death among adolescents globally, according to the WHO report of 2014. It is worth noting that adolescents are the only age group where deaths due to AIDS are not decreasing. Today, it is estimated that more than 33 million people in the world are living with HIV. Of these, more than 22 million live in Africa, with approximately 3,200 people dying every day from AIDS-related illnesses. Furthermore, AIDS is the leading cause of death among adolescents in Africa and the second highest cause of death among adolescents globally, according to the WHO report of 2014. It is worth noting that adolescents are the only age group where deaths due to AIDS are not decreasing.
But we need to remember two things. Despite all the progress we have had, we are also facing challenges. 1.3 million people acquired HIV last year and 9 million still lack treatment. There are signs of hope though, and I think Kenya is showing them with the resilience and partnership that it inspired us. You are leading the journey to HIV integration and sustainability with communities stepping up. Youth-led initiatives are empowering young women to protect themselves and their futures, and people living with HIV leading, innovating, and refusing to be left behind. Let me just finish by calling to action to remain and strengthen the HIV response by mobilizing domestic resources, championing human rights, scaling up and securing affordable and accessible innovation from long-acting prevention to digital health solutions, addressing structural barriers, as is said today, teenage pregnancies, gender-based violence and harmful social norms, and strengthening community-led initiatives because they are our anchor towards the finishing lines. UNAIDS remains committed with the people of Kenya, with the government of Kenya, with you all.
We were in Bungoma, in Mount Elgon. As we did the engagement with the community, we sought to know what was the problem and why were young girls, why were old men sleeping with young girls who are in school and making them pregnant. And one of the things we learned was that there was parental neglect. Another issue that we have to check as parents. Maybe on another day we can engage more and look at all the factors. We ask the students to write for us small papers, not to write their names, but to tell us what is it that they want to communicate to us about the issues we had discussed. on teens pregnancy, SGBV, and HIV infections. You do not want to see what is in those papers, because we assured them the teachers were not reading those papers, but we found that even within the domestic setting, the first risk comes within the people who live around the victims. So you have to check who is around your child, who are they communicating with, who are you inviting to your homes to live there. You know, in Africa, and Kenya being in Africa, sex is not discussed openly because there are issues that culture holds back when it comes to sex education. Maybe a time has come for the Ministry of Education, the Ministry of Health, NSDCC, Parliament, legislature, all actors, executive, to come together with the parents and the teachers, to discuss what should we have as sex education, so that if we have to eliminate this threat by 2030, we must do things in a way that we have not done them before. Even if that sex education will have to be approved by the church, because what has happened now, PCS, is that the social media has preceded the parent in guidance on matter sex. The social media is the one that is now teaching the parents and giving the first lesson on who is a boy and who is a girl. Time has come for us to come round the table. Even if it means it's Bishop Muheria who will do that program. Let's have an acceptable program for sex education so that from a young age, we are able to tell our children who they are, to affirm their identity, and to avoid the confusion of what we are seeing in identity, in gender identity, sex identity, and even in identity as personalities.
As a community of people living with HIV, this year we experienced a lot of disruptions due to the stop work order of the United States of America. But on that note, we also received some milestones through the Department of NASCOP. 4 things that we appreciate that NASCOP has done. 1, they have expanded the eligibility criteria for TAF-LD for people living with HIV/AIDS. 2, they have rolled out better drugs for our children that are palatable and are not the drug that we used the previous times. 3, they have enhanced on DSD, whereby we are having different forms of service delivery, like community pharmacy. We also have community RT groups, and also we have deliveries from other partners that are working with us. But more importantly, they have also enhanced multi-drug dispensing at our facilities.
This is what actually we are talking about in terms of integration, to make sure that we make it lighter for everyone who is living with HIV, to make it lighter on the socioeconomic burden, the things that families have to go through to decide on care, whether to take somebody for hypertension treatment or to take somebody for HIV treatment. And so this is really what we are doing right now, called integration and consolidation. And for me, I am extremely grateful to His Excellency the President for having appointed me to this position. And one of the things I tell our staff, there are very many people who get jobs, but there are very few people who get the jobs they love. But more importantly for me is to put all of that context together as we design our new HIV responses, to make sure it works for the person who does not know anyone, who is not in this room, who will not watch TV today, who can't tweet, who does not even know Irene, because today they were so busy going to look for food, and to make sure that our government responses are felt by the people. And so that's the assurance we want to give you that this is what we are doing in the State Department for Medical Services.